I'm Allie.
And I'm Becky.
We are registered dietitians that are passionate about functional approaches to whole body health.
In this video, we are going to be talking about DHT, what it is, how it gets elevated in the body, and what you can do to strategically reduce it.
Yes. So DHT stands for dihydrotestosterone. It's a metabolite of testosterone that is also an androgenic hormone. We think of DHT levels when we think of male health, and we think of enlarged prostate gland, or we think of male pattern baldness, as there's a whole suite of medications out there as DHT blockers. DHT, when elevated, will actually cause the hair follicles to shorten and to reduce the lifespan of our hair, driving hair thinning.
Now, it's important to note that DHT doesn't just affect men. So when elevated in women, we're going to see hirsutism or hair growth, abnormal hair growth where it shouldn't be, something on the chin or the chest even. We can see PCOS or infertility. We can also see androgenic acne or that kind of cystic acne in the chin area.
And then DHT can equally affect both women and men in the world of mental health. We see elevated DHT as a driving cause towards depression.
So because this is a metabolite of testosterone, that means testosterone is converting in some people in excess into DHT and kind of getting stuck there. Let's talk about what causes elevated DHT.
So some individuals are genetically predisposed to elevated levels. In fact, an increase in 5-alpha reductase pathways is going to yield elevated DHT conversion from testosterone. Now, beyond those that have this genetic predisposition, we can see elevated testosterone in general as a risk factor to DHT elevation. We would especially be concerned about those that are on testosterone therapy. So if using testosterone as a topical gel or as an injectable hormone or as a pellet, this could often drive elevated or mismanaged levels of testosterone, which can drive excess conversion of DHT.
Yeah, so you're taking all that testosterone, but you don't know exactly where it's going to go or how it's going to behave in your individual body. And then beyond taking excessive testosterone or having high testosterone exogenously, we can also see high stress driving elevated DHT. As this is an androgenic hormone, the adrenals are going to pump out more of that testosterone and more is going to get stuck or converted into DHT when an individual is under stress.
Absolutely. Not only is it compounded then with the cortisol, which can drive more belly fat and disrupt blood sugar balance, we also see individuals that are obese or have excessive body fat to be higher risk of elevated DHT levels, as well as those that experience insulin resistance or diabetes.
And as you mentioned, there's a whole suite of medications like finasteride or Propecia that actually inhibit or target this DHT. But we know that when we block a pathway in the body, there can be unfavorable effects kind of downstream. So we often see low libido or loss of sexual function as just one of the side effects of these medications.
So with a functional medicine approach, we're always looking to address the root cause, which would be managing that blood sugar, reducing stress, but also bringing in some food as medicine to optimize the metabolism of DHT without having that blocking effect, which would drive systemic imbalance. We want to make sure that you have a robust libido and balanced hormone levels, as well as supporting healthy hair growth and maybe some of those other issues like resolving the androgenic acne. So we have 5 tips to help you to best manage your DHT levels, starting with relax and regulate. So this would be my number 1 intervention. And this is because it's a powerhouse of 2 nutritional ingredients, magnesium bisglycinate and myo-inositol. Magnesium bisglycinate has been shown in literature as a neuromuscular relaxer. This relaxation offsets cortisol. In fact, we've seen this magnesium bisglycinate be able to target the pituitary in the brain and reduce the stimulus to the adrenals. So we're reducing that stimulus of that androgenic expression. We also know that myo-inositol can support insulin sensitivity. Myo-inositol has been shown in studies to actually inhibit mildly DHT, so it works as a natural DHT blocker, and it helps with sexual hormone balance while reducing anxiety and supporting healthy sleep patterns.
And then sticking with relaxation and stress reduction, we also want to support the adrenal glands in healthy expression of cortisol and not making too much of these androgenic hormones. So AdaptogenBoost would be a fabulous recommendation. This is going to help to kind of pilot stress in the body, keep you from getting excessively burned out, but also keep you from getting too wired from stress. And rhodiola in here in particular has actually been shown to foster hair growth.
Next up would be green tea, or if looking for a more concentrated source, matcha. Matcha in just 1 teaspoon equals the amount of compounds in 10 bags of green tea. So we're getting a high boost of EGCG, antioxidant compounds. We're getting L-theanine, which can help the alpha brainwave activity, getting into a relaxed, calm state, reducing that androgenic expression. And we have higher antioxidant compounds that can support body fat burn while also reducing oxidative stress. Green tea also supports liver metabolism and detoxification. So by using matcha or green tea, we have a little bit of a natural DHT blocking mechanism. In fact, I recommend all of my patients on testosterone therapy to get a teaspoon of matcha daily. This is a great way to offset that metabolite, and the boost of caffeine has been shown in studies to actually spur or support hair follicle growth.
And then sticking with those food as medicine recommendations, we also want to look at pumpkin seeds and pumpkin seed oil. In fact, 1 tablespoon of pumpkin seed oil has been shown to inhibit DHT and support healthy hair growth. We also see pumpkin seeds as a rich source of zinc, as well as essential fatty acids that are going to support hormone balance overall, as well as that thick, lustrous hair.
Our final food as medicine recommendation is actually one of avoidance. It's important to always remember food as medicine is a double-edged sword. It's equally important to focus on those foods that you want to bring in abundance, as important as it is to avoid those foods that are pro-inflammatory, devoid of nutrients, or can disrupt your microbiome or metabolic pathways. One big culprit here is industrialized seed oils. Watch out, because these can be ubiquitous and found almost everywhere in the grocery store. We want you to really hone in on and avoid seed oils such as canola, soybean oil, cottonseed oil. These are highly oxidized and pro-inflammatory. And we've seen in studies that trans fats and industrialized oils can actually elevate DHT levels, disrupt blood sugar metabolism, and as all of our cell walls actually incorporate fat, we can see imbalanced cellular signaling when we have pro-inflammatory fats in our diet. So we want an abundance of those whole food fats like the pumpkin seed oil and olive oil and whole foods such as avocado, but we want to avoid these industrialized seed oils.
For both women and men, we have another video all about stopping hair loss and actually supporting hair growth with food as medicine. So I will link that here below for y'all to check out.
And if you are a woman that's dealing with some of those issues of the hirsutism, that facial hair growth, or the androgenic acne, or you have known hormone imbalance, definitely check out this video here on PCOS. And for all of you watching, be sure to like this video, comment below on something that you've learned, and subscribe to the Naturally Nourished YouTube channel. We have tons of content out now at this point, including videos on how to boost libido, how to naturally balance hormone levels, and so much more. So much content on hormone balance in general. Bye. Okay, sorry.
Smash the like
Let me
button.
try better. I could do it better, but that's kind of where I'm going. Is that okay? We have so much content. Just check them all. Just keep watching our videos, please, and algorithm it up.